So, all super cool. Let's talk about clinical implications. A condition that you are very likely to be asked about when you're being asked about this whole process is one called chronic granulomatous disease, or CGD. And this is when your patient is born without NADPH oxidase. So step number 1 right here is knocked out in chronic granulomatous disease. What that means is these patients' phagolysosomes cannot do the oxidative burst. They can't turn oxygen into superoxide, but they still have another trick up their sleeve. They can still use bacterial peroxide. Remember, I told you, invading bacteria can generate their own peroxide, and your phagolysosomes can turn this peroxide against them without necessarily having to do all the beginning steps of the oxidative burst. Okay, cool. So hope is not lost. Except if these patients get infected by catalase-positive organisms. Remember, those catalase-positive organisms could detoxify their own peroxide. What that means is they're going to go ahead and break down their own peroxide that they came in releasing into water and oxygen, and the phagolysosome isn't going to be able to turn it against them and use it and kill the bacteria. The bacteria is going to get ahead and neutralize it itself first. So these patients can't do the oxidative burst, and then when a catalase-positive organism is there, and remember this is specific to catalase-positive organisms that the second part applies, that peroxide that's being generated by the bacteria can't be used by the phagolysosome because it's going to get neutralized before the phagolysosome even has a fighting chance. That means that patients with chronic granulomatous disease are at an increased risk for infection by catalase-positive organisms. And this is why, and this is a very high yield point. They want you to not only understand this fact, but understand why it works. And there's all of this potential for higher order questions of, then can you remember which organisms are catalase positive? So there's lots of sneaky ways they can try and ask about this pathway, both from a biochem standpoint, from an immunology standpoint, and from a microbiome standpoint. So be on the lookout. So these patients are at increased risk for pyogenic infections with these catalase positive organisms. And as a refresher, some of those are Staph aureus, E. coli, Pseudomonas, Serratia, Klebsiella, Nocardia, Candida, and Aspergillus. And one little courtesy thing they might give you in the STEM to try and tip you off to the fact that this is in fact chronic granulomatous disease is they might talk about a negative nitroblue tetrazolium test. And so basically that's just looking for the activity of NADPH oxidase. When NADPH oxidase is there, normally this colorless dye that they put in to do the test for will turn black. If there's no NADPH oxidase, the test is going to be negative because there's going to be no enzyme activity for a color change. And finally, let's talk about an especially dangerous bacteria, one of my favorites, Pseudomonas. Specifically, we're going to be talking about one of the virulence factors of Pseudomonas aeruginosa called pyocyanin. And I'm going to do this in a blue-green color because this has a blue-green pigment. And this pyocyanin virulence factor is going to give Pseudomonas a really cool competitive edge against some other bacteria in the area. And it's going to generate reactive oxygen species. So what it's going to do is it is going to utilize NADPH to start reducing oxygen and turning it into superoxide and hydrogen peroxide, reactive oxygen species. That's going to force the phagocyte to work really hard and have to waste a lot of its reduced glutathione just trying to keep up with all these reactive oxygen species that the Pseudomonas is throwing at it. However, not only are we chewing up all of this reduced glutathione just because we're producing a ton of reactive oxygen species, the pyocyanin is also going to directly oxidize the reduced glutathione into oxidized glutathione. And that oxidized glutathione can't do anything. We need it to be the reduced form in order for it to detoxify reactive oxygen species. So we're getting this buildup of reactive oxygen species and this real depletion of the reduced glutathione that you need to detoxify the reactive oxygen species. And that is a winning recipe for Pseudomonas, thanks to that pyocyanin virulence factor. So let's wrap this all up. We've been talking about what happens in phagocytes, specifically within the phagolysosome that those phagocytes create in order to chew up bacteria. Those phagocytes are going to laugh in the face of danger, and they are going to create reactive oxygen species in order to kill those bacteria. Of course, when they're done, they then need to make sure that they neutralize those reactive oxygen species that they've been harnessing for killing power to make sure that they don't accidentally go ahead and kill themselves. And both the bacterial killing pathway and the neutralization pathway required NADPH from the pentose phosphate pathway. We started with oxygen and went through a series of steps where we eventually formed more and more powerful free radicals till we eventually ended up with bleach that could just bleach and kill the bacteria. One of those intermediate steps in there was peroxide, and we also talked about how invading bacteria can make their own peroxide, but the phagolysosome is smart and can turn that peroxide against the bacteria, unless it's a catalase-positive organism. And catalase-positive organisms are going to beat your phagolysosome to the punch and neutralize their own reactive oxygen species before it can be turned against them. Now that we've made all those reactive ROSs, it's time to shut them down and neutralize them. And we did that with the enzyme glutathione peroxidase, which turned that peroxide into water with the help of the very important substrate reduced glutathione. And NADPH was also really critical for the formation of that reduced glutathione, and that again comes from the pentose phosphate pathway. Then we talked about some cool clinical implications, the first one being in chronic granulomatous disease. These patients could not perform the first step of the oxidative burst mediated by NADPH oxidase, which was fine until they encountered a catalase-positive organism. And those catalase-positive organisms were self-neutralizing their own peroxide, leaving these patients with CGD effectively defenseless against catalase-positive organisms. And then we talked about piocyanin, which was a virulence factor of Pseudomonas aeruginosa, and how it created all sorts of different reactive oxygen species to outcompete all of its bacterial competitors. And that's all I got for you. Good job, good luck, and keep practicing.